Have you got a minute to hear some of the most commonly asked questions? The first one is, what is dyslexia? Dyslexia is a language-based learning disability. Dyslexia refers to a cluster of symptoms which results in people having difficulties with specific language skills, particularly reading. People can have mild, moderate or severe dyslexia and might experience difficulties with other areas of learning, like spelling, writing or maths. Dyslexia is referred as a learning disability because it can make it very difficult for a person to succeed academically in the typical educational environment. The next question is there a cure for dyslexia? No, dyslexia is not a disease or a medical issue. There is no cure. Question, what causes dyslexia? Well, the exact causes of dyslexia are still not completely clear, but brain imagery studies show differences in the way the brain of a dyslexic person develops, functions and processes information. Dyslexia is not due to either a lack of intelligence or desire to learn, and with appropriate teaching methods, dyslexics can learn successfully. Question, do all dyslexics see print upside down or reverse letters and words? No, this is a myth. Some dyslexics do reverse some letters and words, but many don't. Question, what does a dyslexic person see when reading? Well, there is no single pattern of difficulty that affects all dyslexic people. A dyslexic person might see some letters as backwards or upside down. They might see text appearing to jump around on a page. They might not be able to tell the difference between letters with similar shapes but different orientation, like B and D or P and Q. The letters might look all jumbled up and out of order, or the letters or words might look all bunched together, or the letters of some words might appear completely backwards, such as the word was looking like saw. The letters and words might look okay, but they might get a severe headache or feel sick to their stomach every time they try to read. They might be able to read the word but not be able to make sense of or remember what's been read. So they find themselves coming back to read the same passage over and over again. It's important to understand that when a dyslexic person sees letters or words reversed or mixed up, there may not be anything wrong with their eyes. The problem is in the way the mind interprets what the eyes see. Question. I've heard coloured overlays can help dyslexic children. How does that work? Well, around 30% of people with dyslexia suffer with a visual stress known as scotopic sensitivity or Erlen syndrome, where text appears to move around or look distorted in some way. Coloured filters can help to make the text visually clearer and more comfortable to see, but they'll not teach the child how to read. Question. I think my child may be dyslexic, but the school doesn't seem to know. Well, sadly, that's because dyslexia is not recognised in Australian schools. Educationalists prefer to use other labels. There are some schools who offer support for dyslexic children, but there are still many who have yet to receive training in specific learning difficulties. So signs of dyslexia are often missed or misinterpreted. Question. Do all students with reading difficulties have dyslexia? No. There are other causes of reading difficulties, and they include an intellectual disability or a hearing or vision problem, or not enough appropriate teaching, or emotional problems. Question. Why is only one of my children dyslexic? Even though dyslexia runs in families, it doesn't mean every member of the family will develop dyslexia. Some family members may develop varying areas and degrees of difficulty, or maybe no area of difficulty at all, which then gives them a gifted label. Question. Can a person be intellectually gifted and have dyslexia? Yes. Intellectually gifted dyslexic students might be performing within the average range for their age, but be significantly underachieving when their intelligence is taken into consideration. Question. Does my child require an assessment before he can do a program? No, but some parents like to have an assessment done so they know if their child is dyslexic or not. If you'd like your child assessed, just fill in the box on the side and we'll be in touch to schedule an appointment with the educational consultant who specialises in dyslexic assessments. Question. My child's been diagnosed with dyslexia. Should I tell them? Well, there's no right or wrong answer to this question. For many children and adults, having a name for their problem can lead to a sense of relief. It can be reassuring to learn from a professional that you're not dumb and there's a reason why you find reading and writing hard. If your child's had special education at school or has a tutor to help with reading and still struggle, don't wait for another frustrating year. There is help and hope. And if you'd like to talk to me about the help I offer, please call me for a free, no obligation 15-minute consultation or fill in the box on the side and I'll give you a call. Have a look at the next video to find out about problems with writing.